Okay, now we're going to go over the introduction from this book, John Mcdougall, The Doctor Who Fought for You, written by me, Pete Rogers. Okay, here's a table of contents for the book. And basically, who he was, and then his opinions on specific diseases, the standard disclaimer. If you go down the path of the Mcdougall diet, you're going to need to lower your medication, so work with your healthcare provider. Okay. There's a dedication to John and Mary Mcdougall. Here's a standard chart. Vegans are healthier in every way. Standard American diet is screwed. The East Asian diet, Japan, let's say in the 1970s, was okay, except they had too much sodium and they smoked too much cigarettes. South Asian diet, India, I usually think too much fried food, too much ghee, butter. Okay, the point of starch was it's a polymer of glucose wrapped in fiber, so it stretches the stomach because it's low caloric density. Let's say 1 calorie per gram instead of like 9 calories per gram with fat. Early satisfaction of hunger because it stretches the stomach, and then takes time for the enzymes of the intestine to peel off the fiber separated from the glucose, so the glucose can be absorbed in the blood, so you get a prolonged, relatively normal blood glucose curve. You satisfy your hunger with the fewest number of calories, and that's why starch makes everybody healthy, and it's the best food. Okay, and that's the biggest thing Dr. Mcdougall did. Here's the foreword, very nice, by Jeff Nelson from VegSource. Here is the introduction. First of all, I mentioned everything about Dr. Mcdougall's website. drmcdougall.com is the website, and there's tons of stuff there. They have their telehealth clinic run by his protege, Dr. Anthony Lim. They've got the legacy book of Nathan Pritikin there for free. They've got the legacy book of Dr. Walter Kempner for free. They're both excellent. I read both of them. They're cover to cover. They're both excellent, well worth your time. Numerous testimonials, lots and lots of patients cured by the Mcdougall diet. All the star Mcdougallers. I was one of them too, who lost lots of weight with the help of Dr. Mcdougall. Dr. Mcdougall's monthly nutrition letters, which mostly started, between, let's say, 1997 and 2017, around there. But there were some, before that, going back to 1986. Okay, it's the best nutrition newsletter in the world. The free version of the color picture from the book Food Poisoning, you can get that at his website, drmcdougall.com. Numerous videos, written articles about the common diseases. There's educational courses as well. Here's just like the newsletter archives. Lots of these newsletters are very good. You can go to his website and search those. It's a good place to start when you're researching a new topic. The classic Dr. Mcdougall book, Starch Solutions, probably his best book, his most famous book. And it comes out of the question, the patient says, I'm sick, what can I do? Is there any hope of me ever getting better? He says starch is the solution to your problems. What he tells the patients is just eat 90% of your calories from starch, 5% from veggies, 5% from fruits. If you do that, you're probably going to improve a lot. And while you're doing that, then you can start reading and figuring everything else out. But just do that to start. And then you say, well, why does he say that? Why so much starch? And he'll tell you it's because that's what healthy populations do. That's what the empirical epidemiology evidence suggests to do. Here is digestive tune-up. So basically, all the diseases from your mouth to your butt. And they're mostly food-related, and he explains why. He wrote a whole bunch of books, Healthiest Diet on the Planet. That's the one that's got a lot of pictures in it. He wrote Mcdougall's Challenging Second Opinions, some of his theories of medicine. And I like these old school books where they really challenge conventional viewpoints. Pritikin used to do that too. So you get, a guy who knows a lot and smart, and they really challenge things. You make a lot of progress with that. And he, spent a long time figuring out breast cancer, for example. Mcdougall Program for Healthy Heart. He had seen patients reverse coronary artery disease and peripheral vascular disease in the leg with these low-fat vegan diets like the Mcdougall diet. And so that was actually well known for a long time that coronary artery disease could be reversed. They'd seen it with Kempner reversing EKGs. They'd seen it with Pritikin on himself and his patients. Mcdougall seen it with his own patients, and other persons had written about that as well. And of course, there's the animal studies like the work done by Armstrong. And then there's later the work done by Ornish and by Esselstyn. Okay, the Mcdougall Program for Maximum Weight Loss. The Mcdougall Program for Women, it goes in a lot more detail about breast cancer and what's involved with that. So this is just the intro chapter. And a couple points I made is This book is sort of a summary of Dr. Mcdougall's work. The titles of his videos will usually be in blue ink. The videos reviewed from his channel, they're all from Dr. Mcdougall's channel, his YouTube channel, for example. They're in blue. Sometimes when there's a good eureka moment, I'll put that in green. Usually if something's in red, most of the time that means it's bad or, negative thing related to a disease. Green is the good stuff, Irish green. Occasionally I'll add some of my own clarifying comments, not too often, but when I do it, I'll put them in these brackets to set that off. The book is Dr. Mcdougall. I just here and there throw a couple little comments in. I'll sometimes throw some drawings in as well to explain some pathophysiology. So Dr. Mcdougall, he's a genius. He figured out how you can cure most diseases with the starch-based diet. It's like as big a thing as you can know. Out of everything I've ever learned in over 30 years of being a doctor, that's the most important thing I ever knew. And we really should know that. I mean, you go to the zookeeper. The zookeeper knows what to feed the animals. The human doctor should know what to feed humans. Okay. D.K. Simonton. A genius is someone who transforms a field. Okay, here's a quote from Jonathan Swift, the great Irish writer. He says, "When a true genius appears in the world, you will know him by this sign, that the dunces are all in confederacy against him." Yeah, that's been my experience in medicine. As soon as you get to a high level where you can start to think creatively and recognize problems with the conventional paradigm, you get all these people coming out of the woodwork that are pissed off at you. Because their prestige comes from the established paradigm. A lot of times their money comes from the established paradigm. They do not want innovation. They do not want change. And sadly, most patients are kind of clueless. They sort of think the doctor and the health system are there to help them. That's not really the case. The doctor wants to help you, and there's some fields where they're allowed to help you, like when I was an imaging-guided surgeon. What I would do would help the patient, but usually the guys were, really sick in the last 5 or 10 years of their life. I'll drain an abscess. Great. They'll live an extra 3 years. That's nice. They didn't have to go to the operating room, but wouldn't it be nice to teach them the low-fat vegan diet when they're in their 30s and they can get an extra 30 years of healthy life? Okay, Arthur Schopenhauer quotes, "Scholars are those who have read in the books, but thinkers, men of genius, world enlighteners, the reformers of mankind, are those who have read directly in the book of the world. All truth passes through 3 phases. First, it is ridiculed. Second, it is violently opposed. And third, it is accepted as self-evident. Talent works for money and fame." This is what most doctors are. Most doctors have talent. Some of them are phonies that somehow snuck in there, but most of them are pretty talented and bright. They take their paycheck, they go home, they're happy to get that. A genius works for motives less easy to determine. Talent hits a target that no one else can hit. Genius hits a target that no one else can see. Okay, Oliver Wendell Holmes. "The world is always ready to receive talent with open arms. Very often it does not know what to do with genius. Talent is a docile creature. It bows its head meekly, while the world slips the collar over it. It draws its load cheerfully, and it is patent of the bit and the whip. But genius is always impatient of its harness. Its wild blood makes it hard to train." Yep, that's why they don't like mavericks. Mavericks are very unpopular with the establishment. But the truth is, it's mavericks who make the progress. Okay, here's a nice quote from Ian Fleming, the author of the James Bond movies and books. He says, "All the greatest men are maniacs. They are possessed by a mania which drives them forward towards their goal. The great scientists, philosophers, religious leaders, they're all maniacs. What else but blind singleness of purpose could have kept them in the groove of purpose? Mania is as priceless as genius." And what I would say is it takes a tremendous amount of energy to make a big scientific achievement. And if you read the biographies of scientific geniuses, you will see they often were just these total workaholics, would push themselves to the physical limit. Like Thomas Edison would have all these books on his desk. He would sleep at his desk. He'd wake up, look at his book some more, do an experiment, work, fall asleep again. And there were a lot of them that were kind of like that in some way. Here's Santiago Ramon y Cajal. He's the guy who won a Nobel Prize for drawing these complex pictures of neuron anatomy once he figured out how to stain the neurons in the brain. And he talks about obsession with focus. Every great work is the fruit of patience, perseverance, and concentration. during months and years upon one specific subject. He who wants to discover a new truth must be capable of the strictest abstinence and renunciation. The ideal case would be that of a scientist who, during this period of mental incubation, would pay no heed to any thought that is extraneous to his problem. If he possesses this capacity to remain incessantly absorbed by one subject, he will be able to multiply his strength. Yep, that's why you want to be simple to get more done. Okay, so that's it for the introduction. I hope that was interesting and helpful.